Hello, everyone. My name is Kamal Morar. Welcome to my YouTube channel entitled IR 2.0. This is going to be a series of YouTube videos chronicling several different aspects of my prior experience over the last 15 years. I'm entitling the entire channel "Current Practice Problems and Solutions for Interventional Radiology." The main intent and purpose behind the channel is really to articulate a different vision for the future of interventional radiology as I kind of see it, which I am calling IR 2.0. It is number two, to start a conversation to improve upon the current strategies for private practice. And this is where I want to start off by definitely differentiating. This discussion is really revolving around private practice and not academic practice. And number three, from a personal perspective, there has been a little sense of urgency of getting this information out, especially as of late. For the last probably 10 years, I've had many ideas on articulating the different points that I want to make here in the form of a book. But time has kind of evolved, and I've just been pushing it back and haven't really got around to doing that. But lately, there's been a couple of different things that have made me want to at least get this information out in at least this form with a YouTube channel. A little bit of background on myself. I'm an interventional radiologist that started practice in 2005. After finishing my fellowship at the Cleveland Clinic, I started an office-based lab practice in Dayton, Ohio. During that time, we've also held a exclusive IR hospital-based contract, and off and on we've had anywhere between 4 to 5 IR physicians in our practice, and we are exclusively IR. So now, why now particularly is there an interest on my end to kind of start talking about interventional radiology in the future? The first place is that I feel like there's a bit of a divergent force going on with interventional radiologists. On one end, we have the most competitive subspecialty in the country with the most number of kids wanting to get into interventional radiology. On the other side, we have a very high job burnout rate and dissatisfaction, especially in the private practice setting. Lastly, there's a personal reason for me wanting to present this information now. I'm at a crossroads in my personal life where I feel like I am looking at really what 15, 20 years out is going to look like for interventional radiology, and certainly I'm not getting any younger. Let me start off by citing a recent article in the May issue of JVIR entitled "Shrinking IR Applicant Pool," and I just wanted to illustrate this. Although the article is talking about the shrinking IR applicant pool, what I found very interesting was that interventional radiology is well below all other subspecialties when it comes to the percentage and how competitive the specialty is, meaning it is more competitive than any other subspecialty, where it's only filling even now at only about 30%, compared to dermatology, neurosurgery, orthopedic surgery, ENT, even rad-onc, that are in this, which are historically the most competitive specialties. This is, to me, is telling me that more so than ever before, young folks are very interested in interventional radiology, and folks like us who have been in the space for this long know exactly why that's the case. They're enamored by the procedures and what an interventional radiologist can do. However, on the other side, there's been a recent article in the April edition of JVIR talking about the high burnout rates for interventional radiology, citing that almost 72% of all folks, or of all interventional radiologists in this survey, reported some level of burnout from their jobs. This is a study that looked at physician settings across the board, academics, private, included doctors who are doing diagnostic work as well as interventional work, and and a variety of different call structures. And even though the article specifically didn't mention all the causes for the burnout that are historically there, here's a list of the most common culprits that we all kind of can identify with. Lack of having a procedure mix that you've seen in fellowship, lack of support from your diagnostic colleagues or the administration, call hours, emotional stress, lack of reimbursement structures, getting told that you are constantly doing procedures that are not reimbursing enough, and lack of a clinical infrastructure, whether there's a clinic. On a more personal level, I have a personal interest now. This is my son, Satya Morar. He is a rising sophomore at the undergraduate level at Case Western University in Cleveland, Ohio. He's enrolled in the 8-year direct pathway to medical school program, and at this age, he's already participated in interventional radiology research and has an interest in interventional radiology, which to me as a dad is forcing me to start looking at what the field is going to look like 15, 20 years out if my son were to become an interventional radiologist. And so this has led me to creating this channel now, and at least presenting the few thoughts that I have had for now quite some time to a audience that may appreciate it. The framework for the argument that I would like to present is kind of multifaceted. One is that I feel like there's current information asymmetries in the market which are keeping IR still largely hidden, meaning that patients, referring physicians, by and large, still are not aware of the types of things that we're doing. Technology, on the other hand, has a very interesting potential to disrupt this paradigm in a major way, and I would like to outline how we have been able to do some of this stuff and what I think we need to still continue doing. There is a growing number of patients that I feel will continue to have direct access to IRs in numbers that we haven't seen before. And the question is, how do we foster this to a point where we can take advantage of this? So therefore, the thesis statement for this channel really now becomes, in my mind, specifically, how is private practice IR positioned to be the leader amongst all other surgical subspecialties for all private practice metrics worldwide? In this, I realize that it's a pretty robust statement to make as far as becoming a market leader in all metrics, but I truly believe that we have so many attributes that we may not be looking at it. We may not be looking at it from an appropriate perspective to where we're really optimizing our opportunities. The structure for my channel is going to be a series of short segment, hopefully 10 to 15 minute presentations arguing the thesis, in which I hopefully can make the case for the morality, make the moral case for why it's going to become important for us to become more entrepreneurial minded. Oftentimes, there is a sense by a lot of healthcare providers and professionals that it's not the most ethical thing or the most moral thing to think in terms of an entrepreneurial mindset when looking at establishing a clinical practice. Lastly, this is not an advocacy for any one private practice model over another. I realize that there's been a lot of discussion at our society level talking about preserving different practice models. This is really my attempt to optimize value in all models, private, including hospital and outpatient-based models. So the channel is going to be divided into 18 chapters that I've long been thinking about and wanting to kind of discuss. One would be, what would be the appealing part? What is the appealing part of interventional radiology? Is chapter 1. Chapter 2 would be something to the effect of what is really causing the dissatisfaction. In many cases, many of us are practicing and feel like we're kind of all alone on an island sometimes. Number three would be really looking at what are the main hurdles, what is the main elephant in the front room, and many times I feel like we are mistakenly thinking of diagnostic radiology or even hospital administration as being the main hurdle. And I would argue the contrary. I think that we need to see ourselves from an economic standpoint, and where we may not be providing certain attributes that are needed to be able to get to the next level. Shifting gears a little to private practice and freestanding IR, talking a little bit about the hurdles, the difficulty. In my mind, the number one issue in private practice is patient acquisition strategy. Looking at painting the picture of the perfect world. Like if an IR had a perfect practice to be able to come to, what would that look like? The perfect practice model, maybe creating a framework on where we would like to go, where would that job satisfaction and burnout rate be at an all-time low. Number six, looking at the power of competing on service differentiation and on price. These are two attributes that economists commonly talk about as winning attributes for any business model, which I feel like IR is really in a strong position and has both to offer. Chapters 7 through 12 would be macroeconomic trends in healthcare, and how IR 2.0 would really be aligned with what's really going on with industry norms and industry movement. In this chapter 8, I would like to dedicate one chapter to one of my personal heroes, Professor Clay Christensen from the Harvard Business School, who's a strategist, who is the father of coining the term disruptive innovation, and specifically how his theory can be utilized in healthcare, and more specifically how it could be utilized in interventional radiology. Number 9 would be maybe a short segment discussion on interventional oncology, and whether interventional oncology really is the blue ocean that we all think it really is. Maybe looking at potential threats to it. Chapter 10 would be dedicated to telemedicine and artificial intelligence and its real value to interventional radiology in correcting the information asymmetry for IR. Number 11 would be a discussion on a term called diffusion of innovation, which is looking at the possible tipping points for supply and demand for interventional radiologists, and how that could be something that we as a society could take advantage of. Chapter 12 would be dedicated to unbundling interventional radiology marketing and the value and the need of creating what I call new service brands and silos, where we are marketing the services that we're providing and not necessarily trying to market the subspecialty. Chapters 13 through 18 would be dedicated to the strategy that we've been utilizing at Dayton Interventional Radiology, which is combining our clinical algorithms and creating a offering from a clinical perspective that's a little bit more comprehensive, putting a bunch of the different attributes together under one coherent message. Chapter 14 would be dedicated to the opportunities for IR in the social media marketing space, specifically learning a little bit about customer resource management and the use of even social media influencers. Number 15 would be the concept of market share not being a zero-sum game, and what Simon Sinek has termed playing the infinite game versus the finite game, meaning that many times in healthcare there's a general thought that there's a zero-sum market share, and in actuality that's not the case. If you look at urban and rural markets, there's so much work out there that's just untapped. Chapter 16 will be dedicated shortly to just my personal journey and my personal history for anybody that may be interested. 17 would be leveraging what I call the physician agnostic model. This is kind of a futuristic concept, but something that we are employing in Dayton, where it lends to the scalability of our model, not really identifying the model or a practice based on the name of one physician. and then finishing out looking at specifically how IR on different metrics, economic metrics, from patient acquisition strategy, revenue generation, and service different service lines, how we are in a position and how we can specifically outcompete almost any other subspecialty in the nation. So with that, I want to be able to end today's session with the message that this is an informal YouTube channel. It's just a discussion. I encourage anybody that is interested at any level to ask any questions, make any comments. I'm not affiliated with any society. There's no real censorship here. We're just my only intent is to have an honest discussion, and I just want to be able to get the information out that I have kind of stored up in my mind, and to be able to share that with anybody that finds it relevant. So with that, I'll sign off today. Thank you.